Julie. Curious to know, the Mastercard Foundation invests heavily in, Africa and its youth. Has the pandemic shifted your priorities in how you invest in Africa and its youth?
Thank you so much. Thank you for the question. Thank you for the discussions. I think really, really honored to be here. Just before I jump into answering that question and almost delivering the keynote in that answer, allow me to just say this. I myself am an African woman. I really resonate with your message, though, about, you have this Zambian passport. I have a Kenyan passport, but very much feel the Pan-African Ubuntu spirit. So I love this conversation. And I want to say, while coming at it from an organizational perspective, I also come at this from a perspective as a Pan-Africanist and an Afro-optimist and as an African woman and mother. So I think all of that is important. And so jumping in to really answer that, I'll keep my remarks brief, but try to walk through how the foundation has been navigating this space, what we have been learning in these interesting times, and then maybe end with a personal note that I think connects to what Daktari and Linda have also spoken of. Let me take a step back and just share some context about Mastercard Foundation that I think is always important for everybody to understand. So the Mastercard Foundation was established in 2006 through a gift from Mastercard Incorporated at the time of the IPO. Mastercard did something really unprecedented and decided to set up a foundation in its name, but absolutely completely independent. And that's why it really was a gift to the world. And so we have our own board of directors and management, and we are a fully independent organization. Important to understand the distinction between Mastercard and Mastercard Foundation. Our founding objective was to deepen financial inclusion by increasing access to financial services. Now, in 2009, our board of directors and our CEO made an important decision. It was a defining decision for the foundation's work, and it was to center our work primarily in one geography, in Africa. Now, a decade later, in 2018, so much had been established. We had set up the Scholars Program, done a raft of work around financial inclusion, and we started to ask ourselves, how do we dive even deeper into this, even more strategically? And so in 2018, the foundation doubled down on its commitment through the launch of a strategy called the Young Africa Works strategy. We unified our work now around the issue of young people in Africa and lack of opportunity. We set a bold target of enabling 30 million young people to access dignified and fulfilling work by 2030 with a focus 70% on young women. Now that's important, and part of us being in this room with you is to introduce our mission, our vision, our learnings, but also I'm keen to hear from you about what we should know and how we should work, because you are the center really of our work. So I think really important to say that. Now, we've established and done a lot. You may know of us in different spaces, and for sure, a lot of people have heard about our Scholars Program. I want to just share a number with you. To date, we have over 47,000 young Africans who have gone through our Scholars Program. We're going to double that number and do much, much more. And we continue to learn and to grow. And then, of course, 2020 happened, COVID hit, and all the work we had done, the plans we had done, we had to start to reimagine how we move forward, how we structure our work to really have impact in environments facing huge challenges, new challenges through COVID. So we have launched in 2020 a program called the Mastercard Foundation COVID-19 Recovery and Resilience Program. We've done a raft of work. We started work with the Africa CDC, and I'm going to come to more on that in a moment. And we went deep into our teams at country level to further understand what were they hearing from communities? What do we need to rethink? How can we be agile? And this is an ongoing process. Now, this year, we're building on the response of the COVID-19 Recovery and Resilience Program. We launched the Saving Lives and Livelihoods initiative with the Africa CDC, a $1.5 billion partnership to achieve the following. Number one, to purchase vaccines for more than 65 million people across the continent. Our first batch of close to 1 million, actually just over 900,000 vaccines landed in Kenya earlier this week, and we have more landing across other African countries. Second, we're looking to enable vaccinations for millions more by investing in the logistics of vaccine delivery and administration. And Daktari, I heard you say, the burnout is happening for those who are working, at the front lines of healthcare. There's extra load. We're building the science. We so recognize this and asked ourselves, how can we do more? How can we help? And of course, using the mandated body on the African continent, the Africa CDC, and I'll come back to that in just a moment. Third, we're looking to lay the groundwork for vaccine manufacturing in Africa through a focus on workforce development. So Africa must be able to stand on her own. And in this era, around these public health challenges, we must be able to manufacture our own vaccines, and we can't be left behind. And building that human capital for this is where we are centering ourselves. So strengthening the Africa CDC's capacity is our fourth pillar to oversee this historic vaccination exercise and address future outbreaks. Now, I want to speak to how we are building resilience in a different approach to work, right? A lot of people came to us and said, why would you not have put these funds into COVAX, right? This is a mechanism the world has set up. Why not COVAX? And we said, if we are doing work in Africa, we have to build African capacity, African institutions to meet the challenges of the African continent, period. And I think in 2021, early 2021, when vaccines started to land in countries and it became clear Africa was going to be left out, this was why this approach was all the more important. And so maybe a learning here comes back to African capacity, understanding our own work, understanding our own contributions. Linda just spoke to the fact that, we've been looking to others to help, but we ourselves have been helping our own people, our own communities. We don't document it, but we do it. How do we better recognize that? What is the mindset shift required to build the confidence and then to strengthen our African capacity, our African institutions? Now, as we look forward, there's a lot that we need to learn, and we need to learn it together. I think for me, as an individual, it is about understanding we must look after ourselves to be able to look after our communities, our families, and I think again, rethinking and reframing how we work, allowing ourselves to not look at the norm, 9-to-5 office job, which for so many Africans, there were simply young people locked out of this, is to ask ourselves, what is needed and how do we enable a new way of working, a new way of producing, a new way of collaborating, a new way of building communities. Let's break with the systems that many of them were set up by the colonials who came in, and ask ourselves, what do our communities really need, even in our education systems? And I think this is an opportunity for us to really reframe. I think Daktari said communities are made up of individuals, of people who are, it's humans. We must build individual resilience to build strong community resilience. I want to come back to center it at that and say, we all also need to pay attention to wellness. And this is becoming a big issue, especially for young people, but right across the board as well. If we can ensure that we as individuals are well and whole, we can then ensure our families are well and whole, and we can ensure our communities are well and whole. How do we do this? My final word before I come back to you is that we are interconnected, Nkatia. We are all interconnected. The world is interconnected, and when we didn't give Africa enough vaccines, you start to see people panicking that variants are coming out. Although I'm not sure if they're coming from Africa or just being discovered here. I'm not a scientist, but we are interconnected. We must be well to ensure others are well. We must work to listen, hear each other, understand what is required, reframe our thinking, start to be able to challenge the norms of the past. It does take a lot of work to do these things, but we must do them. And then the final thing is COVID is still with us. Just a message: continue to take care of yourself, protect your family, protect your community. I look forward to the discussion. I've talked too much, and so come back straight to you in the panel. Thank you.